So the answer to this is not very simple because each patient and each case is different. My typical answer is if you could click your fingers or wave a wand and get rid of them, you're probably better off without them. But there is no magic, so when you do have them removed, you have to weigh up the cost, the time, and the pain associated with it as well to see if it's worth it. In this video, I'm going to cover reasons for removal, reasons against, and then other factors to consider. It's a long video, but it's going to be in great detail. If you want to skip to the end to go to the summary, you can do that. First things first, the human jaws just don't grow big enough to fit wisdom teeth properly anymore. And that leads to the main reason people have them removed, which is pain. Now the pain has three main sources. The first is if the wisdom tooth grows through, but there's not enough space, the gum grows over the top of it, food eventually gets stuck underneath the gum, it provides food for the bacteria that are there, it becomes swollen, infected, and really, really painful. To make that worse, if you have an upper wisdom tooth that then starts hitting down into that swollen gum, it makes the pain even worse. As a rule of thumb, we tell people that if the pain is really severe, or it happens at least once per year, those are enough reasons to get rid of them. On a side note, for patients that do currently have wisdom tooth pain or you want to know about that, I've got a video up here that you can click. We'll show you how to relieve that pain. The other main sources of wisdom tooth pain come from the upper wisdom tooth. So if you have an upper wisdom tooth that's growing sideways, as you're chewing, it can start rubbing on your cheek, it can cut the cheek, and that can be really, really painful. Luckily, it's pretty much instant relief once the tooth is gone. The other reason is if you have a wisdom tooth that doesn't have an opposing wisdom tooth, it will keep growing downwards until it starts pinching and hitting down on the gum. That can be very painful. Again, the only solution there is to remove it. Another big reason for their removal is to prevent damage to the adjacent teeth. Because wisdom teeth are so far back, they're on weird angles, they can become very difficult to keep clean. This difficulty leads to food getting stuck around the wisdom tooth, which can cause gum disease, or it can cause cavities on the tooth next door. This is unfortunate because that next door tooth now needs further ongoing treatment, either replacement of the filling in about 10 years time, or consistent really good cleaning if the tooth suffers now from gum disease. This can also happen when you have an upper wisdom tooth without a bottom one to bite against. It grows downwards over time, and as it grows downwards, the contact between it and the next door tooth changes. Food starts to get stuck, again, can lead to gum disease or a cavity forming. So for that reason, consider its removal when it's hard to maintain cleanliness. So some people have wisdom teeth that just don't grow through the gum. They either get stuck underneath or they get impacted against the tooth in front. So most of the time this won't cause any problems, but some of them do. To understand why that can happen, you need to understand how a tooth grows through the bone. Surrounding an unerupted tooth is a little cyst that the tooth sits inside of, and that cyst's job is to basically dissolve the bone and everything in front of it as the tooth is growing upwards or downwards for an upper wisdom tooth. When a wisdom tooth doesn't grow all the way through, this cyst may stay intact. For the most part, it's fine. Now, in 1 to 2% of cases, this cyst can get really big and destroy the bone and compromise the health of the bone or the tooth in front. The other problem is related to an impacted wisdom tooth where it's stuck against the tooth in front of it. The first problem is the eruption cyst can actually dissolve a hole in the tooth that it's impacted against. Unfortunately, because it's happening underneath the gum, it often goes undetected until it's either very sore or it's seen on an x-ray and the hole is really big, and in a lot of cases the tooth has to be removed. In cases where it can be fixed, it's often in a difficult place to actually do a good quality filling that's going to last. So the long-term health of that tooth is now really compromised. The other problem is if an impacted tooth starts to go through the gum, food can actually get stuck in between the wisdom tooth and the tooth next door, again, potentially forming a cavity in that next door tooth, which can be hard to fix. So for those reasons, there's definitely an argument for removing an impacted wisdom tooth to prevent it causing problems. Another reason to remove a wisdom tooth is if it's non-functional, meaning that it's not chewing against another tooth, and it has a cavity. Under normal circumstances, if a tooth has a cavity and the patient wants to keep it, then we do a filling. The problem with fillings is they have to be replaced roughly every 10 years or so. If it's on a wisdom tooth, it's hard to keep clean because it's right at the back. One, it's going to be hard for the dentist to do. Two, that filling will be hard to maintain. So 10 years, it might actually need replacing even more than that. Therefore, there is a pretty strong argument for if you have a wisdom tooth that has a cavity and it's non-functional, if you just remove it, you'll never have to worry about it again. Another reason to remove a wisdom tooth is for orthodontics, and there's two reasons behind this. First is that in some cases, removing wisdom teeth gives us the space that we need to pull the other teeth backwards, which can help fix crowding. The other reason, and there's some controversy around it, is that wisdom teeth used to be believed to cause crowding. This came about in the 60s when a paper was published, and it was often a reason why it was suggested for them to be removed. However, we now know that people without wisdom teeth, they still get crowding, and when you remove them, the crowding doesn't get fixed. It's more attributed to, over time, the teeth shifting forward, which leads to crowding at the front. It's also a bit of a stretch for the idea of one tooth on either side pushing forward 14 other teeth, It's just not very common. But in saying that, if there is some chance that it may cause or contribute to some crowding and it's non-functional, well, maybe consider removing it. There are also medical reasons for their extraction. So patients who are about to undergo, say, chemotherapy or medications for osteoporosis, they will have complications associated with their removal if it's taken out once treatment begins. For this reason, it may be better to actually remove the wisdom tooth before that treatment starts, avoiding potential future complications associated with their extraction. Some wisdom teeth have cavities that are so large they can't be fixed with a regular filling, and in that case, they have to be pulled out. Now we're going to talk about reasons not to remove a wisdom tooth. In my opinion, there's only one reason not to. All of the others, they're just factors to consider when deciding. So the main reason not to remove them is if you don't have to. So there are a small percentage of patients who actually have enough space for a wisdom tooth to fit, and it functions and grows like a normal tooth, and it can be clean like a normal tooth. These are patients who have larger jaw bones that can just house up to 32 teeth, or it may be patients that had other teeth removed for orthodontics, and then all the others have shifted forward, so the wisdom tooth is just like another tooth. In those cases, if you can keep them clean, don't remove them. The next things aren't necessarily reasons not to remove them, just things that you should consider. So one is in cases where you could actually cause damage to other structures. For upper wisdom teeth, they can actually be quite close to the sinus, and their removal can actually perforate the sinus or lead to the wisdom tooth being pushed into the sinus. These two complications, they can be avoided and they can be fixed, but if the risk is high, it might not be worth doing. For lower wisdom teeth, they can actually be situated quite close to a nerve that supplies touch to your chin or taste to your tongue and feeling to your tongue. If during their removal those structures become damaged, it will actually affect the feeling to either the tongue or the chin. Most of the time it does actually come back, but in some cases it doesn't, so you've now got that for life. So in those cases where there's a moderate to high risk of damaging other structures, you really have to weigh up the pros and cons. Some people have medical conditions where the hole after a tooth is removed doesn't heal properly, so the risks associated with their removal may actually outweigh the benefits of the removal. Another thing to consider is the cost. Removing a wisdom tooth is often not easy, so normally it's done by someone who's quite experienced. This may also be done in hospital. Therefore, the treatment can be pretty expensive. Pain and recovery time are also things to consider. Pain and discomfort can be expected for about a week, but sometimes 2 weeks. If you're averse to being in pain, this is something for you to think about. The age you are is also a factor. For younger patients, 1, they heal faster, and 2, the bone is a lot softer, so often the wisdom tooth comes out easier. If you're over the age of 45 and you haven't had any problems with the wisdom tooth in the past, it's not likely that you will. So if you're under the age of 30, or even better, 25, that's a better time for you to do it as opposed to being above the age of 30. So the last thing to consider is how many do you remove. Now there is some merit in removing just the one that's painful. It might be a bottom one or a top one. But don't be surprised if your dentist or surgeon suggests, hey, why don't we remove both of them on that side? Or let's just remove all 4 of them. Why would you do this? Well, rather than doing it separately and maybe having to come back for another one later on, you can just do it all together. You won't have to worry about it again. So as you can see, there isn't a simple answer. Each patient and each case is different. But if I was to sum up my advice, these would be the points. Now, if we could wave a magic wand and just get rid of them like that, that would be awesome. They're hard to keep clean, they're often not used in chewing, and typically they cause more harm than good. If they give you severe pain or moderate pain more than once per year, that's a good reason to remove them. The pain that I see patients go through, I wouldn't wish that on anyone. If the pain is less severe or less frequent, either learn how to manage that pain, and you can watch this video to help, or if the risk is low and you're a young patient, it might be better to just get rid of them. You'll never have to worry about them again. So if yours are underneath the gum and they're not causing any problems, well, ideally they wouldn't be there because then you never have to worry about them again. But having them removed, you have to think about the time associated, the pain, the cost, and also if their removal isn't low risk, it might not be worth it. If you do decide to leave them in place, that's okay, but just make sure that at least every 3 to 5 years you're having a full mouth OPG x-ray taken to ensure they aren't causing any problem. If yours are above the gum, not causing any problems, and you can maintain them, don't remove them. In these cases, I'd still recommend once a year checkups just to make sure that there's no problems with the wisdom tooth or the next door tooth. If you have an upper wisdom tooth that's not touching against a lower one, it may grow downwards over time. 2 problems. One is it might pinch against the gum down the bottom and cause pain, but also as it moves downwards, the contact between it and the next door tooth tends to change. Food starts to get trapped. That can damage the next door tooth or the gum, and that's bad, so maybe it's better to remove it. The other thing to consider is if you're going to get one removed, think about removing the others as well, either at least the one on that side or just all 4. The reason being is that once they're all gone, you'll never have to worry about them again. And if you're going to be in pain anyway, you may as well just do it at once. My exception to that rule will be if they're difficult or risky to remove. They're upper wisdom teeth and they're very high up because often they don't cause any problems. You're above the age of 45 and they haven't given you issues up to this point. You're averse to dental treatment or pain, or the cost is too high. I hope you got something out of the video. If you did, please like, subscribe, comment, share the video. It really helps me out a lot. If you have any questions, put them in the comment section. I will get back to you. And I sincerely hope that you don't have wisdom teeth pain because I know that it's not very fun. Have a great day and keep on smiling.